We continue with head-to-toe examination. Mouth and oropharynx. Observe movement of the mouth and lips and note any asymmetry. Inspect the lips for symmetry, color, edema, and lesions. Note odor of the patient's breath. Inspect the buccal mucosa and gums for color, ulcerations, lesions, or trauma. Observe position, color, and number of teeth. Inspect tongue for color and texture. Assess the tongue for atrophy and movement. Cranial nerve 12. Inspect the hard and soft palates for color and appearance. Ask the patient to say ah and stroke the palatal arch with a tongue blade to observe for the presence of the gag reflex. Cranial nerves 9 and 10. Note the presence and size of tonsils and any exudate. Assess taste. This is for cranial nerves 7 and 9. For the neck, palpate the lymph nodes in the neck area. Palpate carotid pulses one at a time. Determine the position of the trachea. Palpate thyroid. Auscultate carotid arteries and thyroid for bruits. Upper extremities. Inspect the contour of the clavicles, scapulae, and shoulders. Palpate the sternoclavicular and acromioclavicular joints, acromion process, clavicles, and greater trochanter of the humerus. Test range of motion of the shoulder and elbow. Assess biceps, brachioradialis, and triceps reflexes. Assess radial and brachial pulses. Inspect the hand. Palpate for tenderness. Test ROM of the hand and wrist. Patient seated and facing away from examiner with back exposed. Posterior chest and back. Inspect skin for lesions. Note thoracic configuration. Palpate the spine. Percuss the kidneys. Assess the lungs. Evaluate thoracic expansion. Palpate for tactile fremitus. Percuss the chest. Determine diaphragmatic excursion. Auscultate the posterior thoracic cage. Note breath sounds. Patient seated and facing examiner with chest exposed. Anterior chest. Determine the shape and symmetry of the thorax. Assess the lungs. Establish the respiratory rate and pattern. Palpate for crackles and rubs. Evaluate thoracic expansion. Auscultate for breath sounds. Assess the heart. Visualize the apical pulse. Auscultate for heart sounds. Assess the breasts. Inspect the breasts with the patient assuming the following positions: arms extended over the head, pushing hands on hips, hands pushed together in front of chest, and leaning forward. Inspect the breast for size and symmetry. Inspect the skin for texture and color. Inspect the venous system. Inspect for lesions or mosses. Thank you for listening.